Why I come to work every day is to change people's lives, to make them smile again, to make them feel confident.
Being able to make someone that was self-conscious feel confident, that's also huge.
We have taken people who refuse to smile and give them a smile where they are so happy. And when a patient leaves, when you've changed that, it's amazing. It is a great feeling.
Well, what people say about DSO is that we practice corporate dentistry. Well, there's no such thing as corporate dentistry. Our doctors provide the services to the patients. We don't interfere in their decisions. We don't ask them to do anything that they're not comfortable with. They literally are in charge of their particular practices. They can do and provide the services that they believe are important for the patient and really care for the patient, give them the best clinical outcome. And it's all in their judgment. It's up to them. They can do what they want to do.
A DSO is a dental service organization. Essentially what we do is we work with dental practices to handle all of the back office that goes on in a dental office. That would include all the human resources, the IT, the finances, any financial things such as filing taxes, preparing financial statements and things like that.
For us at Great Expressions Dental Centers, we're commonly branded and because we have a dense network of offices in a metro area, it puts us that much more, at risk for criticism, I guess, in those areas. And you've got to come at brand. You're only as good as your last patient. So, to us, it actually tells us to step up our game and, provide better care.
An orthodontist with high standards would want to come work for Great Expressions because they can focus their talents on a clinical aspect of what they learned in their residency. They don't have to be involved in the business aspect of orthodontics. They have very experienced team members that help them do that part, so their pure focus is on clinical care.
So when we're recruiting, we're looking also for someone who is willing to learn, that can understand that you constantly learn in dentistry, you can constantly become a better dentist.
A mí me encanta trabajar para Great Expressions porque yo honestamente pienso que cambiamos vidas todos los días. And if you understood that, we really want you in our team. It is really important for our staff to be bilingual so our patients can feel at ease. They can understand treatment, they can understand fees. We can understand each other, and then at the end there will be no doubts about our treatment and what they're getting from us.
The kind of people that fit in here are going to be those folks that are passionate about what they do, are willing to look at what they do in and day out to improve.
There's a variety of different doctors that come to us with different experiences and they're at different paths in their career. And so we've really tried to develop different levels that will fit each of those needs.
We have a career path for doctors, which starts at the associate level and moves into senior doctor, senior clinical doctor, and to become a partner with Great Expressions and participate in the overall health of the company. So it provides them a great opportunity that they wouldn't really have as a solo practitioner.
We place young doctors, in many cases, with more experienced doctors, so they can actually be in the treatment room or review cases with the young doctors so that they can grow. And I mean, instantly. I think that the learning curve is so much quicker if you're a young dentist with Great Expressions.
I have several more experienced doctors that I can call on a whim, text, email, get in touch with, and it's been really helpful. There have been times that I ran into cases that were above my head, and it's just nice that I'm not expected to jump all in, and I love jumping all in, but when it comes to clinical, I want to be sure that I could turn to someone that can help me.
The mentoring program at Great Expressions allows new grads, even experienced doctors, a fresher look at how things can work in a clinical setting. So I teach them to be perfectionists at what they do, very precise at what they do, while doing all that while delivering the customer service, making every patient feel like they're the only patient in my office.
I mentioned possibly, and not just me, but other doctors have mentioned, hey, I might be interested in orthodontics, limited orthodontics. Soon enough, we were trained in Invisalign, so it's wonderful. There's a lot of continuing education opportunities that they put together. They take the worries of putting that all together. We just show up and learn.
I can do as much as I feel comfortable with, and even if it's something where I don't quite feel comfortable with, I want to get a little bit more knowledge, I have the availability to ask somebody else if I can either come to their office and see, or if one of the regional administrators can come and sit with me while I'm doing something.
Our team dynamic is, the best way to put it is we're a family. In the morning we have team huddles and we regularly go over our patients' charts for that day and the coming week. And as a team with the dentists, the hygienists, the assistants, the front desk team and myself, we all review all the patients' charts beforehand and really care about each individual that's coming through our doors.
Our team in every office consists of at least one doc, hygienist or two, practice administrator who is the office manager, a practice coordinator who assists in claims and things like that, and a variety of assistants. It depends on what the dentist needs. And you've got the hygienist, and the hygienist is obviously an important part of is one of the most important parts of the team.
At Great Expressions, there's a wonderful working relationship between hygienist and doctor. The doctors completely trust the hygienist in terms of recommended treatment. There's a wonderful open communication between the two with reviewing, the patient's history and deciding what treatment is best.
It really comes down to allowing doctors to get into the offices, do what they do best, which is see patients and take care of patients, take everything off the table that might be the administrative burden that somebody in a solo practice might have, so that they can, again, focus on the patient care.
We have a joke at the office. So when I leave it at the door, and I really do.
Working for Great Expressions is a good experience. It allows me to have the freedom to do my own work without having the hassles and the troubles of running a practice, dealing with the billing, dealing with insurance companies. My front desk staff takes care of that, and I get to put all my energy and efforts into dentistry.
The National Doctor Panel is a group of clinical partners within our organization. They are the clinical leaders in our company. And what they do is they meet on a quarterly basis and they review things such as our drug formulary, our clinical protocols, the labs that we use, and really addressing the issues that we are having within the offices on a clinical basis. May not necessarily be issues, may be opportunities as well.
At Great Expressions, our philosophy of care is nothing short of excellence. In the orthodontic world, we hold all of our doctors to the highest standards, which is the American Board of Orthodontics. Whether it comes to record keeping, charting, and patient care, clinical results, held to the highest standards.
Great Expressions is involved in the community through basically all of our team members. We have had dentists and staff members go on missions. We've been to Africa, we've been to South America, Central America, providing work for people who just can't afford dentistry or, in fact, don't even have dentistry available to them.
We're in 9 states, but we concentrate very heavily in a market, and we build our network there. That gives access to our patients in that community, and it makes us step up our game, really, because we're providing care to that community, so we have to care that much more about the way Great Expressions does business.
Great Expressions gives back in a couple different ways in the communities and at a national level. For example, Feeding Children Everywhere is a really popular event. The employees will show up with their family and friends, and we're able to package 15,000 meals in under an hour. And then when we're done, those meals go out into the local communities in which they live. And it's just a good feeling. Everybody leaves with a great feeling, and it's fun to see your coworkers charged up.
We play a role in a variety of ways. I mean, of course, we take care of the preventative care of the patient through hygiene, through making sure that their teeth are clean, and they do all those kinds of things. Everybody's not born with perfect teeth, so we have great programs to make those teeth so much better. People love straight teeth, and so we have programs for, be it Lumineers, be it Invisalign, be it orthodontia. It provides them with the image of a really nice looking person is, and so that's what's so important. So the cosmetic end, while, may seem trivial, it's so important to the patient. It gives them great confidence.
I know a smile gives you the confidence that you need, whether it's getting that job, finding a lifetime partner, whatever it might be. I know that smile is going to impact them one way or another. They may or may not remember my name, but they'll remember that orthodontics changed their lives.
At Great Expressions, we do it all for you.
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 En Great Expressions lo hacemos todo por ti.